Okay, so we will be discussing continuation of Module 4, Body Systems. So we will be discussing today about the blood and immunity and respiratory system as well as digestive system. Okay? Medical terminologies for the above mentioned topics. Okay. Okay, first is blood. So in the circulatory system, uh, we discussed that blood flows throughout the body and it is either deoxygenated or oxygenated blood. Furthermore, uh, the blood that circulates through the vessels, aside from bringing oxygen, it also brings nourishment to all the cells. At the same time, during the gas exchange in the capillary level, there also exchange nutrients and waste. Yung mga nutrients from the oxygenated blood ay nag-exchange ng mga waste products ng mga cells at ito ay dumadaloy sa uh, deoxygenated blood. Okay? The total amount of or the total volume of blood present in the human body of an adult is approximately 5 liters or 5.2 quarts. Okay. So yan, totality yan sa uh, lahat ng adult human being. Okay? And this 5 liters is divided into a liquid component and non-liquid component or formed elements. 55% of the blood volume is plasma, while the remaining 45% are blood cells or the formed elements. Okay? So yung blood natin hindi lang siya liquid, kundi meron siyang solid component, which are the blood cells. Okay. So plasma is 90% water and 10% nutrients, electrolytes, gases, okay, albumin, clotting factors, antibodies, waste, enzymes, and hormones. Kung makikita nyo sa image, okay, this image ay dumaan to sa centrifuge. Okay, centrifuge is a device used to separate the plasma from the blood cells. Okay? So centrifuge yung device na yon. Usually makakita tayo ng centrifuge sa laboratory department. Okay. So yan. Makikita natin the plasma 55% and the blood cells the remaining 45%. Okay? And most of the 45%, of course, are the erythrocytes or the red blood cells. Okay? So, and then the remaining few or remaining amount or quantities are white blood cells and platelets. Okay, so the pH of the plasma is 7.4. Okay? So usually dito pinapattern yung mga ginagamit natin ng mga detergent, may mga sabon, na yung kanilang pH level ay ipinapantay nila sa plasma. As well as yung ating mga contrast media na ginagamit for radiographic examinations, okay, inilalapit nila sa pH level ng plasma. yung mga contrast media para hindi siya magkaroon ng uh, adverse reaction once the contrast media is introduced into the bloodstream. Okay, so blood cells, so ano mga kabilang sa blood cells? We have the erythrocytes or the RBC, the leukocytes or the WBC, and the platelets or the thrombocytes. Okay, maraming klase ang of course ang red blood cells erythrocytes. But the white blood cells marami siyang klase. Meron siyang neutrophil, eosinophil, basophil. Okay? Meron din siyang lymphocytes, monocyte. Okay? Tapos merong platelets, mga thrombocytes. Okay? So we must remember that all blood cells are produced in the red bone marrow. Okay? So when you're asked, saan napoproduce ang red blood cells? Red bone marrow. Saan ang napoproduce ang white blood cells? Okay? Red bone marrow. Okay? Saan napoproduce ang platelets? Red bone marrow. Okay? However, okay, some of white blood cells multiply in the lymphoid tissues as well. So, saan ba yung lymphoid tissues natin? So, lymphoid tissues, ito yung mga tissues ng mga glands na part ng lymphatic system. Paano ba yung mga lymphatic glands natin? We have the thymus, the tonsils, and the spleen. Okay? So, baka nakakalimutan nyo na last meeting lang yun. Okay? Okay, so the neutrophils, okay, there are two types of white blood cells. We have the granulocytes and the agranulocytes. So bakit siya tinawag na granulocytes? Kasi siya ay para siyang granules. Okay? Meron siyang component, pag tiningnan nyo siya sa microscope, para siyang merong mga granules. Okay? So, ayan. 67 or 54 to 62% of the total white blood cells are neutrophils. Anong function ng neutrophils? Phagocytosis. Again, what is phagocytosis? Okay, so syempre, medical term yan. So, how do we identify the term? So, phago means to ingest or to eat or to engulf. Okay, cyte, okay, cell, alam natin cell yan. Then, cis is, ano ibig sabihin ng cis? Phagocytosis. So definitely phagocytosis means it is the process of engulfing, eating, ingesting other cells or um, waste or infectious agents or microorganism. Okay? Then we have the eosinophils, which is 1 to 3%. So it reacts. Okay? It is responsible for allergic reactions and defense against parasites. Then we have the basophil, less than 1%. So it also acts when there is an allergic reactions. Then we have the agranulocytes. Okay, we have the lymphocytes, 25 to 38%. It functions in the immunity spectrum. And then of course we have the monocytes. Okay, 3 to 7%. Also acts as a phagocyte or action niya is phagocytosis. Okay, so these are the white blood cells. Okay. So before I forgot, the lifespan of the red blood cells is 120 days. That means nagkakaroon ng reproduction or napapalitan yung ating RBC every 120 days. Kaya nga, during yung mga blood donations, okay, tinatanong kung kailan huling nag-donate ng blood. And usually, ang inaano ng mga uh, organizer ng blood donations ay at least 3 months or 6 months na from the last uh, blood donation. Okay. And also blood donation is a way is a good way in replenishing the RBC. Okay, now we move to the blood types. Are you familiar with your blood type, or do you know your blood types? Oh, talaga? Hindi niyo alam? Okay, sayang. Anyhow, um, Domestic ang gumagawa niyan, pwede naman natin gawin yan during a laboratory session. Madali lang naman ang blood typing. Okay, so we have 4 blood types. Actually, we have 20 blood groups. But ang pinakakilala lang or ginagamit natin is yung blood grouping na ABO. So we have A, blood type A, type B, AB, and O. Okay, the key in blood types, so ang pwede lang mag-donate at makatanggap ay yung may same blood type. Bawa, blood type A ka, hindi ka pwedeng tumanggap ng blood type B. Okay? Ganon din, pag blood type A ka, blood type B, hindi ka pwedeng tumanggap ng A. Okay? Hindi ka rin pwede tumanggap pag blood type A ka naman at ikaw ay tumanggap ng AB, so magiging AB ka na. Ganon din sa sorry, mali. Okay. Ang blood type O ay tinatawag na universal donor. Universal donor, okay? Ang blood type AB ay tinatawag na universal recipient. Okay? Ibig sabihin, si O, pwede siyang mag-donate. Pwede siyang mag-donate sa tao may blood type na A, B, at AB. Okay? Ngayon, si AB naman, pwede siyang tumanggap ng dugo galing sa A, galing sa B, at galing sa O. Okay? So yung A sa yung B, hindi sila pwedeng tumanggap hindi sila pwedeng mag-donate ng dugo from yung B sa O hindi pwede, yung A sa O hindi pwede. Okay? Yung AB sa O hindi rin pwede. Okay? So ang pwede lang mag-donate kay O ay same blood type. Letter O ay yung blood type O pa rin. Naintindihan ba yon? So A sa A, okay, pag donor A, ang pwede lang niyang ma-donate na blood ay letter A at AB. Okay? Si B naman, pag donor ang B, ang pwede lang siya mag-donate sa may blood type na B at AB. Okay? Then si AB, okay? pwede siyang mag-donate, pwede lang siyang mag-donate sa A, B. Hindi siya pwede mag-donate sa B, hindi siya pwede mag-donate sa A. At lalong hindi siya pwede mag-donate sa O. Okay. Pag ang O naman, pwede siyang mag-donate sa A, sa B, sa AB, at sa O. Kaya siya tinatawag na universal donor. Okay? So paano po nalalaman ang blood type ng isang tao? Okay, in blood typing, mayroon dalawang serum. Mayroong anti-serum, anti-A serum and anti-B serum. So dalawa yan. So nang pre-prick sa finger para makakolek ng drops ng blood, and then lalagay siya sa slide yung blood. Okay? Papatakan ng dalawang drop magkahiwalay. Tapos yung blood drops na yon, yung isang blood drop papatakan ng anti-A serum, yung isa papatakan ng anti-B serum. Okay. So kapag type A siya, sa anti-A serum, ang itsura ng red blood cells, okay, ay nagkakadikit-dikit sila or agglutinated. Pero yung anti-B serum niya, hiwa-hiwalay yung red blood cell. Okay? Then kapag naman type B, ang blood type mo, so yung anti-A serum mo, hiwa-hiwalay ang RBC, but yung anti-B serum ay agglutinated ang RBC. Ibig sabihin, nag-react yung anti-B serum sa iyong red blood cell. So siya ay type B. Kapag type AB, so both anti-serum anti-A serum and anti-B serum ay agglutinated ang red blood cells. Kapag type O naman, okay, siya ay both na hiwa-hiwalay, not agglutinated. Okay? So nakuha po ba? So importante po na alamin natin kung ano yung ating blood type. Okay? Para sa mga emergency purposes. Ako ay type O. Okay. So usually naman nasa family naman 'yon. Katulad ng yung mother ko type O. Mga kapatid ko type O. Okay. Okay, now we proceed to the immune system. So the immune system, so madalas yan yung napag-uusapan during the vaccine nung itong COVID-19, di ba, immune system. So ano ba immune system? So it is a response of the body, okay, that protects our body from invading microorganisms or pathogens such as bacteria, viruses, okay, fungi, and other pathogens. Okay, so we have two types of immunity. Okay, so we have the passive immunity. Okay, so that involves the transfer of antibodies to an individual, either naturally. Okay, example nito yung through the placenta or the milk, mother's milk. Okay, or pag by administration of an immune serum. Okay? And then we have the active immunity naman. Okay, yung active immunity involves the individual own response sa disease do sa organism. Halimbawa, nagkasakit ka, tapos magpo-form ka ng antibodies and ayun, meron ka ng immunity. Nagkakaroon ka somehow ng natural immunity. Okay? That is active immunity. Kaya siya tinawag na active kasi you dealt with the pathogen. Okay? Kasi yung sa passive, ito ay kung nakakuha ka ng antibody sa pamamagitan ng pagsasali ng sa mother's milk or to the placenta, yung sa blood flowing to the placenta, and then through the administration of an immune serum. Yung immune serum, hindi siya vaccine, kung hindi siya ay naglalaman ng mga antibodies. Okay? And then another way para magkaroon ng active immunity is by the means of the vaccine. Okay? An artificially prepared vaccine. Okay? Now we move to the suffixes that are used for blood. So we have the emia or hemia, which means condition of blood. Okay, so the example is pakemia. Okay, thickness of the blood, ibig sabihin, malapot yung blood, pakemia. Then, pinya. Pinya means decrease or deficiency. So, leukopenia, deficiency of leukocytes in the blood or deficiency or decrease in white blood cells. And then, poesis. Poesis is formation or production. So, example niya ay hemopoiesis, production of blood cells. Meron din tayo tinatawag na erythropoiesis. So, erythropoiesis is the production or formation of red blood cells. Okay? Okay, now roots for blood and immunity. Okay, we have myelo, okay, pertaining to the bone marrow. Okay, so myelogenous, originating in the bone marrow, or myelography, radiographic examination of the bone marrow. And then we have the hemato, which means blood. The example is hemorrhage, profuse flow of blood. Then we have the erythro or erythrocyto, okay, which means the RBC or red blood cells. So erythrocytosis, examples of condition of increased red blood cell. Then we have the leuco or leukocyto or the WBC. The example is leucopoiesis, so production of the WBC. Then we have the lympho or lymphocyto or lymphocyte. So lymphoblast, immature lymphocyte. So pag blast, immature siya. Kapag class, adult na siya. Then we have thrombo. Okay, thrombo meaning blood clot. Thrombolytic pertaining to dissolving a blood clot. Or thrombolytic, an agent or a drug that dissolves a blood clot. Thrombocyto means a platelet or thrombocyte. So thrombocytopenia, deficiency in platelets in the blood. And of course, we have the immuno, okay, which means immunity or immune system. Okay, so immunization means product or production of immunity. Then roots for chemistry. When we say chemistry, okay, these are compounds or elements that can be found in the blood. Okay, we have the azoto or nitrogen compounds, azoturia, so meaning increased increased nitrogen compounds in the urine. Then we have the calcium. So we have the calcareous containing calcium. Then ferry, which means iron. So we have the ferry. Then sidero, iron also, sideroblast, immature red blood cells containing iron granules. Then we have Kali. So that is potassium. Okay? So hypokalemia means decreased potassium level in the blood. Then we have natri, meaning sodium. So natriuresis, excretion of urine or of sodium in the urine. Then we have hypoxemia, deficiency of oxygen in the blood. Okay, so any questions before we move to the respiratory system? So you have to read in your book regarding the different diseases, disorders, treatment, uh, yung mga supplementary terms, pakibasa rin sa book. As I have said earlier, hindi ko na madidiscuss lahat. So all you have to do is to read the book. Now we proceed to the respiratory system. So its main function is to provide oxygen to the body for energy and metabolism, as well as to eliminate the carbon dioxide as produced in our body. The organs of the respiratory system, we have the nose, the pharynx, the larynx, the trachea, the bronchi, and the lungs. Okay? So in breathing, the medical terminology for breathing is ventilation. Okay? And then we have the term inspiration and expiration. Okay? So yun yung medical terminology na dapat nating gamitin. Kapag inhalation siya ay inspiration. Kapag exhalation ay, ang tawag natin ay expiration. Okay? Then suffixes for respiration, we have niya or breathing. So, the example is orthopnea. Then we have oxia or meaning is hypoxia. Then we have capnia, okay, which means level of carbon dioxide. Example is hypercapnia. Okay, when we also have aphonia, okay, which means voice. Okay, so the example is dysphonia, difficulty in speaking. Okay, now for roots for lungs and breathing, so we have phren or preno, meaning diaphragm. Okay, example is phrenic or costophrenic. Then we have phrenic or phrenico, pertaining to the phrenic nerve. And next we have pleura or pleuro, pertaining to the pleura. Okay, then We have pulmo or pulmono, which means lung. And also we have pneumodo, means lungs. Okay. Then we have pneumo or pneumato. Okay, so yeah. Then we have the sphere or spiro, meaning breathing. Spirometer instrument for measuring breathing volumes. Okay. So do you have questions? Again, pakibasa na lang ulit supplementary terms and key terms sa ating book. Okay, now we proceed to the digestive system. So function of the digestive system is to prepare food for intake by the body cells. Okay, and it can be broken down into mechanical or chemical means into the molecule that are small enough to be absorbed into the blood circulation. And digestive takes place in the digestive tract, also called alimentary canal or the GI tract or gastrointestinal tract. Okay? So these are the roots for the mouth. Dami. We have or oro mouth, stoma, stomatomouth, nato, jaw, labio, lip, bucco, cheek, dento, teeth, odonto, teeth, gingiva or gum, lingo or tongue, glosso, tongue, sayalo, is saliva or salivary gland or salivary duct, and palato means plate. Okay. Any questions? Now for the roots for the digestive tract, except for the mouth. Okay, we have the esophago, of course, esophagus. So these are part of the alimentary tract. We have the gastro or gaster, stomach, pylorus. Pylorus is part of the stomach. Then entero means intestine or small intestine. Duodeno, duodenum. Then jejunum or jejunum means jejunum. Okay, jejunum is part of the um, small intestine. Then we have the ileum, and then the cecum, okay. Then we have the colono, which means colon or large intestine. Then we have the sigmoido, which means the sigmoid colon. Okay. So dito, um, mapapamiliarize nyo yung sarili nyo sa kung alin ba ang part ng small intestine at alin ba yung part ng large intestines. Okay. So you have to familiarize with that. Okay, the continuation we have the recto, which means rectum, or procto, which also means rectum. And of course, the last one, ano, which means anus, okay? Or yan yung kay mga part pa rin yan ng alimentary tract. Okay? Then we have the roots for the accessory organs. The digestive systems have accessory organs. Ano yung mga accessory organs ng digestive system? So we have the liver, the gallbladder, and the pancreas. Those are the accessory organs of the digestive system. Okay? So the hepato, so liver, the bili or bile, the cole or colo means bile also or gall, cholecysto means gallbladder, cholangio means uh, to vessel ng bile or bile duct, cholangio, colodeco, coledeco is common bile duct, and then pancreato is pancreas. Okay? So, may tanong, mga example, okay? Nandiyan naman mga example like cholelithiasis, okay? Choledo uh, ectomy or cholecystectomy, cholangitis, pancreatitis, pancreatectomy, okay, and so on. Okay, so that ends our discussion for today.